collagen loss, facial volume loss, and dull, listless skin. These 3 symptoms of aging are a recipe for disaster when it comes to maintaining a youthful appearance into our later years. But what if I told you this one treatment can address all 3 of those issues? In this video, we're going to take a deep dive into the anti-aging benefits of Sculptra. Stay until the end for a bonus segment where I'll tell you my favorite Sculptra treatments for my patients, and even better, the Sculptra treatments that I've done on myself. Let's get into it. Hi my beauties, my name is Dr. Stefani and I'm a board-certified, double fellowship-trained cosmetic dermatologist in Newport Beach, California. And there's a lot of buzz lately about Sculptra and the anti-aging benefits of Sculptra. I frequently get asked, is Sculptra worth it? We're going to discuss the anti-aging benefits of Sculptra and how to use Sculptra to build collagen and restore lost facial volume. So many people will ask, what is Sculptra? Sculptra is considered a biostimulatory filler, and it's comprised of poly-L-lactic acid. What biostimulatory fillers do is they stimulate the skin's own regenerative processes to act and behave younger, which gives long-lasting, beautiful, natural-looking results. It increases the skin cell's abilities to make the extracellular matrix proteins, the collagen, the elastin, the glycosaminoglycans, all those things that give skin that restorative volume that kids and adolescents and babies have. That's why they have beautiful, bouncy, smooth cheeks. We lose that over time as we gain wisdom and have birthdays. So by stimulating the skin cells to act and behave younger, you restore those extracellular matrix proteins. Being a Mohs micrographic skin cancer surgeon for decades, I would look at skin under the microscope and I would look at those extracellular matrix proteins and I would see the difference under the microscope histologically on a cellular level what the skin looks like in a 30-year-old versus a 40-year-old or 50 or 60 or 70-year-old. And I could see what patients were undergoing certain cosmetic treatments and how that affected the way their skin looked under the microscope, which was highly fascinating and which is why I wanted to engineer a skincare line, and I got all this information, and I don't want to go on a tangent on this video, but doing things like stimulating your skin cells to act and behave younger gives a beautiful clinical appearance to the skin, but that correlates with what we see under the microscope when we look at the cells and the histology on a cellular level. By inducing your skin cells to make all these products that we start to stop producing over time will give skin a beautiful, youthful appearance, not only with the texture, but with restoring volume in areas like the mid-face and areas like the temples. Sculptra is not my favorite for the temples, and I'll get into that a little bit later, but people definitely use it in the temples, and before Lanluma was launched back in like early 2010-11 period, we would use it in the temples, we would use it in the mid-face, we use it in the booty for booty volume and growth, we use it for texture improvement on areas like the abdomen, the inside of the arm. And the other biostimulatory filler that's in that same category is also known as Radiesse, and that is calcium hydroxyapatite. And so these 2 biostimulatory fillers, Sculptra, which is poly-L-lactic acid, and Radiesse, which is calcium hydroxyapatite, both work in the same mechanism of action. So unlike hyaluronic acid fillers that are restoring volume loss by actually like a mass effect, by an actual foreign body being in there kind of expanding the skin to treat nasolabial folds, marionette lines, temples, lips, tear troughs, these fillers are more injected into the skin to stimulate your body to do the work. And so that's why I think there's more of a trend towards Sculptra and biostimulatory fillers in today's world in 2023, because we're kind of, the pendulum is swinging the other way because people have been overfilled with hyaluronic acids for way too long. So what are the pros and cons of Sculptra? A pro is that you're inducing your skin's own ability to naturally enhance volume and to upregulate the skin's ability to act and behave younger. And that's always better. That's why I love lasers. That's why I love energy-based devices. Anytime you can induce your skin to do the work and act and behave younger on a cellular level, the results are more natural and longer lasting than just passively injecting a bunch of filler. Now, hyaluronic acid fillers play a different role. They're useful for non-dynamic rhytids, usually nasolabial folds, marionette lines, tear troughs, lip injections, things of that nature. Now, you wouldn't put biostimulatory fillers in those areas. Those are more hyaluronic acid treatment areas. And so they act differently, but the reason why I like biostimulatory fillers a little bit better than hyaluronic acid fillers is because it is injected into the skin, it stimulates the skin cells, and then it's gone. And then activation of those skin cells will have a long-lasting effect for 1, 2, possibly even 3 years that won't dissipate or get metabolized or get eaten up and need to be re-injected. Sometimes hyaluronic acid fillers can only last 6 months. The one I use in my office usually lasts about 18 months to 2 years. but some of the hyaluronic acid fillers don't even last that long. So a pro of Sculptra is that it does last long and it gives natural looking, beautiful results because you're inducing your skin cells to do the work. You're not passively using a mass effect with a foreign body that's going to augment the volume and make the skin look better, or making the ailment that you're trying to correct look better. Let's talk about the aging process and why Sculptra is so good at anti-aging. The reason is because as we get older, our skin cells become a little bit more senescent. And what does that mean? When we're babies, or when we're young, or when we're teenagers or adolescents, and even in our early 20s, the skin cells are acting and behaving younger. They're having a transepidermal time of only 28 days. They're making a ton of collagen, a ton of elastin. They're renewing themselves. The baby stem cells are replacing the older mature stem cells or skin cells, and we're increasing the cellular renewal. That all slows down as we get older, so doing things to stimulate our skin cells to act and behave younger becomes really important. And that's why I love lasers and energy-based devices so much. And that's why I also love biostimulatory fillers so much. It's a different mechanism of action than a laser with photons, or an energy-based device with ultrasound or radiofrequency heat putting into the skin to stimulate collagen. Biostimulatory fillers have a chemical induction of increasing the skin cells' ability to naturally restore those processes that have started to slow down as we get older and we gain wisdom and have birthdays. So patients always ask me, how long does it take for Sculptra to work and how long does Sculptra last? They used to say that you would need a vial per decade. So if you're in your 40s, you would need 4 vials spaced about 1 to 2 months apart. If you were in your 50s, you'd need 5 vials spaced about 1 to 2 months apart. But in my practice, in being a cosmetic dermatologist for almost 20 years now, I've noticed that most people always respond to about 2 to 3 treatments. Whether you're in your 30s and say maybe you're very fit and have very lean muscle mass and you have very little fat tissue in your face, you will probably need about 2 treatments spaced about 1 to 2 months apart. Now, if you're in your 50s and you're just starting to notice some volume loss in your mid-face and you're losing a little bit of that jawline contour and you're having some saggy jowls or loss of elasticity in the lower face because of that volume loss, you will also probably need about 2 treatments spaced about 1 to 2 months apart. It typically takes Sculptra about 2 months to really show results. So what happens is, hey guys, if you're liking this video so far, be sure to click the thumbs up button and subscribe to my channel. Your support means the world to me. Okay, back to the video for you and back to the beach for me. When Sculptra is injected into the tissue, it's a precipitate. It's actually a solid precipitate that gets reconstituted in a saline or water type solution. And all that solution that gets drawn up into the syringe and injected, and we usually fan it into the mid-face or the booty or wherever we're putting it, in the arms, the legs, the abdomen, for collagen stimulation and textural improvement. Regardless of what it is, you're going to be swollen. So when patients, for example, in the mid-face get their treatment, they may look swollen, but then that swelling goes away about a week later and then they're back to their baseline. And they may think, well, hey, did this even make a difference? And then about 1 to 2 months later, they'll start to see the results of their natural skin's ability to restore that volume. And they'll look beautiful and they'll look restored and they'll look rejuvenated. And it's a beautiful look, but it does take about 1 to 2 months. Typically, on average, it's more like 2 months. So when you leave the office, you're going to be full, but you're going to be swollen. Then the swelling goes down and then you're back to your baseline. And about 1 to 2 months later, then you're looking beautiful, and it lasts for about 2 years. What is the Sculptra Glow? The Sculptra Glow is that beautiful radiant skin that you get after receiving a Sculptra treatment that typically happens anywhere from a few weeks to even months after the treatment because of an upregulation in collagen stimulation, which gives skin a beautiful glass skin, flawless, radiant glow. What are Sculptra side effects? The side effects of Sculptra are usually bruising, swelling, which typically my patients never really have any bruising, and it's hard to tell if swelling is actually edema or swelling of the tissue, or it's actually just the product that we're putting into the skin. Remember, when we reconstitute the precipitate, which is the polylactic acid, in a solution like fluid, when we inject it into the skin, a lot of that swelling isn't really even swelling. It's just the actual saline or water solution that's in the skin to deliver the particles to the skin cells where they're going to have their mechanism of action and have their effect. So once that fluid dissipates, then you're pretty much back to your baseline after about 4 to 6 days. Let's call it a week. So bruising and swelling are typically the most common side effects of Sculptra. But to be honest, nodules have been noted in clinical trials and anecdotal data to happen sometimes. So because of that, we usually recommend something called the 5-5-5 protocol. So after you have your injection of your Sculptra, you'll be a little swollen and you'll look like a chipmunk, and you may or may not have some bruising. If you're my patient, you probably won't. And we have you massage the area for 5 minutes for 5 times a day for 5 days. And by doing this, studies have shown us that there is less incidence of nodules with Sculptra. Now, I'm going to be honest, I'm probably going to jinx myself, knock on wood. I've been in practice for a very long time, and I've never seen a Sculptra nodule. Now, I always have my patients do the 5-5-5, and I probably shouldn't jinx myself like that, but I always have my patients massage. Now, I feel that the massaging technique and protocol is really important to maybe maintain and prevent nodules from forming, but I also do feel like it makes the Sculptra disperse through the tissue easier and with a little bit better results. And I've actually tried it on myself. I actually had Sculptra injections into my booty for increased booty growth. I'm very petite and don't have much back there, so I have to lift and eat protein and do M-Sculpt and do Sculptra in my booty to maintain booty volume. And I remember one time when I did Sculptra, I kind of wanted to do a controlled study on myself, and I only massaged one booty cheek and not the other one, and I swear the one that I massaged had a better result and had a little bit more volume than the one that I didn't. So then ever since then, I always massage, and I never skip a day of my massage protocol after Sculptra. So I recommend that all patients or anybody watching this who does have their Sculptra treatment, make sure that you do the 5-5-5 protocol, because that is important, because nodules can be a side effect. So what is the difference between Sculptra versus Radiesse? Both are biostimulatory fillers, both work very well. Sculptra is polyalactic acid and Radiesse is calcium hydroxyapatite, and they both induce the fibroblasts to make collagen in the skin cells to act and behave younger. But in my practice and what I've learned along the way is there's certain areas of the face that perform better than others when it comes to what type of filler and biostimulatory filler that I'm going to inject and what we're trying to correct. So it depends on the patient's anatomy, what we're trying to correct, and the area that we're targeting. It governs the type of filler that I do. And again, I've been doing this a long time, so I've used everything everywhere. And in my office, we have all the fillers that are available, and I can pick and choose which one is best for each individual patient with a customized approach. But this is what I've learned. Sculptra is best for mid-face volume loss. Last week, I did a video on lower face laxity and rejuvenation, and a lot of you guys asked me Sculptra for jowls. Now, that's a tricky question. So you can inject Sculptra in the mid-face that can lift up on the jowls a little bit, but Sculptra would not be my biostimulatory filler of choice to target this area. Volux for jawline contouring would be my filler of choice when you're talking about the lower face. When you're talking about the mid-face with these smile lines here, with the nasolabial folds, or when people look cachectic or sunken or with volume loss in the mid-face, that's where Sculptra performs the best. Could you use Radiesse in this area? Absolutely. Do I use it? I don't, because I have used it in this area, and head-to-head Sculptra performs a lot better than Radiesse in this area. Now, let's fast forward to a different treatment area, facial laxity and biostimulatory fillers. Radiesse beats Sculptra when it comes to neck laxity and horizontal neck bands. In my experience, hyperdilute Radiesse, which is calcium hydroxyapatite, does a lot better for neck laxity and stimulation of collagen and improvement of texture in the neck than Sculptra does. And for booty volume, I think it's a tie. I would say Radiesse and Sculptra both restore booty volume very beautifully. And when it comes to like the inner arm, crepey skin on the inner arm, those crepey skin that we get on the inner thighs, crepey skin on the abdomen after having babies. A lot of my patients come in after, having babies, having some textural issues with the abdomen skin. I feel that Radiesse does a little bit better job than Sculptra when it comes to that indication, but Sculptra knocks it out of the park with mid-face volume loss. Another area that comes up a lot is the temples, and a lot of people use Sculptra for the temples. Being a board-certified, fellowship-trained aesthetic provider and expert in this field, I personally don't use Sculptra in the temples. And when I see people doing that, it kind of shows me that they may lack a little bit of their training. Back in before 2008, which is like totally dating myself, but Sculptra was the only filler that we really had available for the temples. Then Voluma came along. Gosh, I think it was probably like 2012, 13, and Voluma is now the winner for temporal volume loss restoration. And the reason is it's a lot safer because it's a hyaluronic acid filler. God forbid something goes wrong, you can reverse it with hyaluronidase, and I won't even get into how to do that. A provider who's doing these treatments should be able to reverse a complication should that happen, God forbid. And Sculptra is a little bit more higher risk because if something happens or there's a vascular occlusion, you can't undo that. There's no enzymatic hyaluronidase or vitrease to restore that temporal vascular occlusion should that happen. And I hate even talking about this, but a lot of patients will come in saying, doctor, I want Sculptra in my temples. And I'm like, no, you don't want Sculptra in your temples. You want Voluma in your temples, or a high G prime hyaluronic acid filler that is reversible, God forbid something happen. I also think Voluma gives better results than Sculptra in the temples. But again, Sculptra is my favorite for mid-face volume loss and for booty volume. Now, if you follow other dermatologists or other skin experts online, they may say something different, but we're all a product of our experiences and our training. And where I trained at UCLA and I did, my advanced fellowship training in aesthetics, we learned to do certain things a certain way, and that's how I've been trained, and that's how I get my best results. So Sculptra, I don't usually use in the temples. I only use it here and in the booty, and then off face sites for skin texture improvement. Or I use Radiesse. So many people asked with my last video, how does Sculptra tighten the jowls? Or how can Sculptra be used to restore the jowls or lower face laxity? And again, I guess if you're injecting here, it can lift up on the jowls, but that wouldn't be my first treatment of choice for that area. But it does an amazing job of lifting up on the kind of smile lines here that people start to get, and the nasolabial folds. And whether you're older and mature and you've had some facial volume loss, Sculptra does a really beautiful global improvement of that whole mid-face area. Or if you're younger, I see it all the time when people have a rapid weight loss or a lot of fat loss, or they're training for a marathon, or they're a fitness competitor, or they're training for a fitness competition, and they lose a lot of that fat in their face, which people, athletes, and very fit individuals can get. It'll make them look older. Even if they're in their 20s or 30s, they'll look gaunt and kind of like sunken in the face, and that's when Sculptra really plays a really incredible role with natural, beautiful looking results. So the more fit you are, you lose weight everywhere, including in your face, and that can age us in the face, and Sculptra is a great rescue and a great treatment for that. A lot of people also ask Sculptra versus PDO Threads, and what's the difference? Because PDO Threads is also made up of polyolactic acid, just like Sculptra is, and actually the two do a pretty similar and beautiful job of restoring mid-face volume loss, but the PDO Threads, you can think of it as like a string like Sculptra. It's pretty much a similar chemical that's going to induce the induction of like facial volume restoration, but there's a mechanical pulling on the tissue that the PDO Threads provides that Sculptra does not. Sculptra also can lift a little bit, but it's not a string or thread that's mechanically pulling on the tissue, but it is like a slow depot of Sculptra product when you're doing PDO Threads, because not only are you lifting mechanically, but you're also stimulating those fibroblasts to make collagen and restore volume as well. Sculptra versus Lanluma. Both products are polylactic acid, and both have the same mechanism of action. There is a thought that perhaps Lanluma works a little bit more faster and efficiently than Sculptra does, but there's been no head-to-head data in research clinical trials to demonstrate this. So I feel that it's more patient preference if one works better for you than the other, but for all intents and purposes, both are the same chemical with the same mechanism of action. Sculptra under eyes. Although I love a good tear trough filler and correction of under eye hollows, Sculptra would not be my filler of choice to correct this area. So just from doing this over 15, almost 20 years now, I have experience with using all kind of fillers in all facial planes and locations to correct certain ailments that we want to improve. And for a tear trough filler, Sculptra would not be my go-to. Probably a very low G prime hyaluronic acid based filler, and the ones that are FDA approved for under eye hollows would be my patient preference. Sculptra Microneedling. So you guys know I'm not a huge microneedling fan, but when using Sculptra as a drug delivery and vehicle delivery system for getting that PLLA into the deeper structures of the skin, I feel that it could be effective. So what is the Sculptra Cost? And that can vary with your location, with where you live, and how many providers are in your area. Typically, when you get Sculptra, it's one vial of Sculptra, and it gets reconstituted into about anywhere from 6 cc's or different syringes that are used to kind of reconstitute that Sculptra mixture that gets injected into the skin. And depending on how many vials you do, and if you're in a package, or if you're at a Medi-Spa, or if you're at a plastics office, it may highly variable. So I can't really comment on the Sculptra Cost because it really can be highly variable with the area that you're in and the number of vials that you're getting. I also want to talk about Sculptra for fine lines and wrinkles and Sculptra for acne scars, because we've been talking about increasing volume, but it also helps with the texture of the skin. So for acne scars, usually laser resurfacing is my go-to for the first treatment for acne scars. But when you combine it with Sculptra or biostimulatory filler, it can help with pox-like scars, boxcar scars, and the pitted kind of acne scars that we see. It just helps rejuvenate that area and helps improve the texture, not only from the polylactic acid or the Sculptra itself through that mechanism of action, but even injecting the Sculptra into the skin, you're almost doing a subcision with the needle while you're inducing the skin cells to kind of remodel that scar tissue and to kind of lyse those adhesive bands that are tethering down acne scars. And when you combine that with a laser, that's next level results right there. Same with fine lines and wrinkles, especially those little ones that you get, maybe when you're not at rest, but when you're smiling, those little guys, those do really, really well with Sculptra. And again, typically I give my patients about 2 vials, but I do it at 2 separate treatments. So we'll give the first vial, we'll have the patient come back in about a month or 2. They're usually super stoked. They're really happy. They look at the before and afters, they're like, oh my gosh, I love this and I want a little bit more. And then at the second treatment, they're pretty much, I hate to say they're gone, but they do very well. And the results are really impressive and it's really natural looking. So it's not scary. It doesn't alter your face like sometimes hyaluronic acid fillers do. We're coming out of this epidemic where everybody has these overfilled faces from hyaluronic acid fillers, and Sculptra just doesn't give that look. It gives a really beautiful, long-lasting, natural-looking result. So let's talk about Sculptra results and Sculptra before and afters. Usually when patients come back after a Sculptra treatment, they will just look more rejuvenated and their facial balance will be more in harmony. So I always like to look at before and afters because this is something that we learn in aesthetic fellowship training. When the eyes scan the face, the brain perceives things as healthy, sick, young, or old. And if you're one of the derm residents that I teach, or if you're one of the medical students that I teach, or if you're a subscriber to my YouTube channel and you'd heard me say this before, I feel like this is a really important topic because certain things that the brain perceives will make us look sickly or older. And that's where we have kind of that sunkenness right here. So patients come back after having Sculptra and they have this really beautifully balanced facial symmetry and restoration of that kind of volume loss that was making them look older or almost sick-like. And so patients usually still look like themselves, they just look more volumized. And when we have it in the booty, when you have Sculptra follow-ups come back after booty injections, their booty has more volume and it also helps with the cellulite and texture regularities of the booty skin as well. So they don't look like anything's been done, but they just look beautiful and healthy and restored. My favorite Sculptra treatments, as promised, is definitely the same for my patients as what I do for myself. So I always tell my patients I would never give you guys any treatments that I wouldn't do for myself. And I feel that Sculptra for me, I've used in the past for the pre-auricular area and mid-face volume loss, especially not only as I gotten older, I'm 46 now, but because I work out and I have, a lot of volume loss, the more cardio I do, the more I feel like I lean out in my face and I lose volume in my face. And I do cardio, I do spin, I work out 5 times a week and I eat clean. And I feel that sometimes I can lose volume here. And I've used Sculptra in the past to kind of restore that volume loss. And I haven't done it now in almost about 2 years, but the Sculptra that I did 2 years ago is definitely still there because I haven't had to do it. So I prefer biostimulatory fillers for myself over hyaluronic acid fillers because I feel that they look more natural. And I'm always about, for myself, doing treatments that are going to induce my skin cells to act and behave younger, not just passively giving myself a bunch of filler and making myself look weird. I like to do lasers, energy-based devices, biostimulatory fillers because it's enhancing my body's own regenerative processes in the skin to act and behave younger and to look younger. So for me, that's a personal preference. And for my patients, I do the same thing for them. Mid-face volume loss, Sculptra is my go-to. Also for my patients, a lot of booty volume restoration with Sculptra, and I use it for myself too. I've done Sculptra in my booty probably 3 or 4 times, and I do it about every 2 to 3 years, maybe, probably every 2 years.
Let me guess, this is Stephanie's Tuesday?
It is Stephanie's Tuesday. for your booty volume, you usually use a lot more vials than you would use for your face. For my face, I would use probably maximum 1 vial, and for my booty, I probably do 4 vials per cheek. But it definitely makes a difference, and it gives good volume, and I love it. My patients love it. And again, these are treatments with Sculptra that I do on my patients, on myself. Thank you guys so much for joining me and hanging out with me, and thank you so much for joining our YouTube family, where we can share non-sponsored information and content and honesty and truth in aesthetics, which is an industry that is getting highly infiltrated with sponsored content and people that you don't know if you can trust them or not. So thank you so much for believing in me and for supporting me, and drop a comment in this comment section and share this channel with anyone who would want non-sponsored dermatologic content from a board certified dermatologist. All right, you guys, thank you so much. The 3 most common questions I get about Sculptra from my patients, don't mind my mini, is how long does Sculptra last? How long does it take for Sculptra to work? And what is the cost of Sculptra? The cost of Sculptra can vary depending on your provider or the area that you live in and how many vials are needed to correct for the volume loss. The results, once they manifest, lasts about 2 years or so, and it takes about 1 to 2 months to have the full effect of the Sculptra. And I'm not gonna let my adorable little daughter distract me. And she definitely doesn't need any PLLA because she has soft, squishy cheeks, but with upregulation of those signal transduction cascades, you too can have skin just like this with Sculptra. Well, maybe not this good.